Hi, good morning to one and all. Today's lecture topic is soft tissue management and impression techniques in FPD. Okay. Coming to the learning outcomes, at the end of the lecture, you should be able to discuss the prerequisites of successful, predictable impression making with elastomer, explain three ways to ensure access to prepared tooth structure for impression making, recognize the importance of gingival tissue displacement, describe different impression techniques for FPD, outline the disinfection technique uh, for various materials. Okay, so first of all, coming to the objectives of soft tissue management. So it is to obtain a dry, clean operating field. Okay, it's for easy access and visibility, to improve properties of dental materials, to protect patient and operator, also to improve operating efficiency. Okay, so there are two basic ways you isolate. The isolation control is done of fluids. Okay, that is a mechanical method and a chemical method. Okay? In mechanical method, there's rubber dam, suction tips, high volume vacuum, uh, saliva ejector, and slab doper. Need for controlling the fluids. Okay, so preparation of teeth, large volumes of saliva and water has to be removed. Cementation and restoration. Impression making is better when there is little or no fluid. Okay, ideally no fluid. Yeah. Rubber dam. So it is used for isolation of one or more teeth from the oral environment. The application in prosto is basically for core buildup and making inlay onlays, which is also less used. It's very difficult to do a tooth preparation for FPD under a rubber dam, guys. Okay, so like it cannot be used with the polyvinyl siloxane impression as it inhibits the polymerization. Okay, so high volume vacuum. Yeah, so these are suction tips which can be helpful for removing operatory debris. It's useful in the preparation phase, effectively with an assistant, and also an excellent lip factor. Okay, sorry, that was a high volume vacuum. Yeah, now is the saliva ejector. Uh, and it's like an adjunct to high volume, you know, evacuation of the saliva or fluids, but it can be used alone for the maxillary arch, placed at the corner of the. Also, it can be used for a mandibular arch, guys. Also, it has to be placed in the corner of the mouth, opposite the quadrant being operated, and the patient's head is turned towards it. Okay, very effectively used in the maxillary arch for impression and cementation. It also can be for mandibular arch. Cotton rolls and cellulose wafers. Okay, so we usually use cotton rolls, easily and readily. So they are of observance. Provide moisture control with saliva ejector. Isolation of maxillary teeth can be done by cotton roll in facial vestibule. Isolation of mandibular teeth, a medium-sized cotton in the vestibule, and one large one between the teeth and tongue. So you can see where you want to put it. Cellulose vapors can also act as a retraction and provide additional absorbency. Okay, a slave doctor is for isolation, so you can see in the photo, and evacuation of mandibular teeth. The metal ejector with attached tongue deflector is excellent. Okay, so you can see that. It's most effective when used in the patient with the upright position. Disadvantage is that it access to lingual surface of the mandibular teeth is limited. It can't be used with mandibular tori, and it may injure soft tissues. Okay, chemical methods of fluid control. So we have seen mechanical. Now we are seeing the chemical methods. Antisyllagogues are agents which control the salivary flow. Yes, it has a side effect of dry mouth. Drugs which are used, these are all the bromides. Okay, so benthine and probenthine. Okay, and also can be given, okay, local anesthesia. So retraction of the gingival tissue, this is done to obtain maximum exposure of the finish line, okay, and to make a complete impression of the preparation, including both the prepared and unprepared surface. Importance of a finish line, so basically to get the marginal integrity, okay, so the marginal fit is very important in preventing recurrent caries and gingival inflammation, okay. Methods of gingival retraction, now coming to chemical, mechanical, and surgical. Coming to the chemical method, mechanical methods. First is the copper band. Okay, so it used to carry the impression as well as displace the gingiva to the expose the finish midline, to expose the finish line. Technique of copper band is its velvet tube corresponding to the size of the prepared teeth. One end, if the tube is trimmed to follow the outline of the gingival finish line. After positioning and contouring the prepared tube, it is filled with modeling compound and impression is made. Okay, so it can be filled up and an impression can be. Retraction cord. This is the retraction cord. So pressure packing of retraction cord into the gingival sulcus is also used. We'll see more about it in the upcoming slides. Okay, techniques to use a retraction cord. So first of all, we use a cord packer, that is the instrument. So these are three types: universal, small, round, and round. So 1 to 1.5 mm and going to 3 mm. So a cord can be packed with this special instrument like a fissure packing instrument. Okay, coming to gingival retraction procedure. So a 2-inch piece of retraction cord is cut off and twisted and made tight as possible and small as possible. And a loop of retraction cord is formed around the teeth and held tightly with the thumb and a forefinger pressure. And placement is started by pushing the cord into the sulcus on the mesial surface. Okay, so from mesial you could do the distal. Okay, so it is slightly packed into the distal crevice to hold the cord in position while it's being placed in the mesial portion. Okay, so the cord is placed subgingivally. The instrument must be pushed inside, as you can see, slightly towards the area already tucked into the place. Okay, so if the force of the instrument is directly away from the area previously packed, the already cord will be pulled out. Understand? So you have to start slowly packing and you can see the impression there, okay, of the cord. You have to go from mesial to distal. Occasionally, it is necessary to hold the cord with one instrument while packing with the second. So sometimes you do that, but most of the time you don't need to do that. The instrument is slightly angulated towards the root to facilitate the sublingual placement of the cord. Okay? So ideally, it should not be parallel, or otherwise it'll rebound and push. So that is what this diagram is showing. Okay. Excess cord is better to be cut out from the mesial interproximal area. Okay, so here you can just cut it out. The placement of the distal end is finished until it overlaps the mesial. Okay, and it is made sure that the force of the instrument is directly towards the cord previously packed. Okay, so and a little can be left out. So after taking the impression, it can be easily removed. Okay, so you cannot place the cord so shallow, it has to be a little deep. Okay, so this is the correct placement, this is the incorrect placement, this is the incorrect placement. You can just compare. Okay, yeah, so this is again just showing how do you do it. So you take the cord, you measure it around the teeth, you twist the cord, you cut the axis, start packing with the mesial. You take the cord packer from the mesial to the distal, guys, subgingivally, push push push, pushing motion. This is already placed in, this is out. So going from mesial to distal, okay, axis is cut and it is pushed, and impression is made and then taken out later. Okay, chemical mechanical methods of gingival retraction. So a chemical is with pressure packing in the retraction cord. So we what do you call, dip it into a chemical. So that is a chemical mechanical method which results in enlargement of gingival sulcus as well as control of fluid seeping from gingival sulcus. Okay, so chemical basically used are the local vasoconstrictors. Okay, which shrinks the gingival tissues a little bit. Okay, so epinephrine, aluminum chloride, aluminum sulfate, ferric. Okay, ideal requirements of chemicals used for gingival retraction cord should produce effective gingival displacement and hemostasis, should not produce any irreversible damage to gingiva, should not have any systemic effects. Okay, surgical methods of gingival retraction. Okay, so surgical methods, there is gingivic touch, that is rotary curettage, and electrosurgery. Okay, so rotary curettage is a drawing technique wherein a portion of epithelium within the sulcus is removed to expose the finish line, guys. Okay, so it should be done in healthy gingival tissues. The criteria should be there should be no bleeding on probing. The depth of the sulcus should be mm. Technique of the rotary curettage should be, it is usually done simultaneously along with the finish line preparation. Portion of circular epithelium is removed using a torpedo diamond burr, and that improves the tactile sense, from the hand. Sorry. So it is to improve the tactile sense and also to have it running very slowly. Okay, abundant water should be sprayed during the procedure, so there's no thermal heat produced in the teeth. Okay, and we are not harming the pulp if it is there, if it's a vital teeth. Okay, so a cord, the retraction cord is impregnated with aluminum chloride, and it can use to control the bleeding. Okay, disadvantage is that it has poor tactile sense, so this technique is very sensitive and it is potentially damaged. This is um the surgical handpiece, which is here, that same. Yeah. Okay, indications would be areas in inflammation of gingival tissue where retraction cord cannot be used, gingival proliferation around the prepared finish lines. Okay, contraindication is patients with pacemaker, any use of topical anesthesia such as ethyl chloride and other inflammatory aerosols. Okay, which has to be avoided. Okay, so gingival sulcus enlargement. Okay, or removal of edentulous cuff, okay, or crown lengthening procedure. So in these indications it can be used. Okay, so that was the end of the gingival retraction and the types and the techniques used. Okay, so now we'll come to the impressions in the RPD. So definition of an impression is a negative likeliness or copy in reverse of the surface of an object, an imprint of the teeth and adjacent structures for use in dentistry. Impression materials are non-elastic and elastic. In non-elastic, there are plastic impression compounds, zinc oxide, eugenol. In elastic, you have hydrocolloids, agar, alginate. Non-aqueous elastomers, here we are using our FPD impressions, right? Silicones, condensation, addition, vinyl silicon, polysulfates, polyether, okay? This we do not use polyether and silicones are there. We are usually using, okay? Impression techniques can be divided into monophase and dual phase. Monophase is usually a single step. Medium viscosity material is used. Dual phase is using one step or two step, heavy putty, heavy bodied, and light body wash. Okay, and spaced and non-spaced. Okay, monophase impression technique is a rigid impression tray of a size 2 to 3 thickness of an impression material is taken. We brush a thin layer of VPS tray adhesive on the tray and allow it to air dry for 5 minutes. Using a firm full stroke of the dispenser, we fill the entire tray with the monophase impression material as seen. Okay. Okay, so we are loading the tray. Okay, so tray filling will take 2 minutes. Okay, for the syringe around the prepared teeth, dispense it in the intraoral. So you dispense slight amount of material in the prepared teeth. Okay, remove the retraction cord if you have placed one. If not, no problem. And inject the monophase material around the clean and teeth. Okay, so you place it slowly seat it in the mouth. The tray must be seated within 1 minute of the start of the oral syringing, within 2 minutes of the start of tray filling. Okay, so just place it on time. Oral setting time is 4 minutes. That's important that you have to know. Remove the impression, rinse dry, and disinfect. The stone model may be poured after 30 minutes. Okay. Apply a downward pressure along the peripheral tray to break the seal, because these are very tight impression materials. They take tight space, and remove the impression from the mouth. Inspect the impression for evidence of defect or tears. Thoroughly examine, explore any sulcus, dentition, anything remnants around the teeth. Okay, so it's a very stable material. It can be poured up to 2 weeks, but of course you should as soon as possible. Okay, coming to the dual phase putty wash technique, there's essentially three ways of recording a putty wash technique: one stage and two stage. So one stage is a putty and wash are recorded simultaneously, also called twin mix or laminate technique. Two-staged unspaced technique is a putty is recorded first, and after setting relined with a thin layer of. Okay, so one stage impression is you can just put a little bit light body, put the heavy body here, and just take an impression, and there you can see the impression. Okay, two-stage unspaced is putty is recorded first after setting relined with a thin layer of wash material. Disadvantages is additional time of having to wait for two materials to set. Okay, contamination of the putty with saliva, yes, that is there. Difficulty to reseat it back in the mouth. Okay, two-stage space technique, which we are using usually in the department here. As for this, it creates a space for the wash. Okay, so it'll be more accurate. Okay, so polythene spacer over the teeth prior to making the putty index is placed, recording the putty impression before tooth preparation, and placing the putty and providing escape channel for the wash. Okay, so polythene spacer is made. Okay, it can be any polythene spacer. Okay, and so example, this is just the mouth of the patient, and then you take a heavy body on top. Okay, right, and then the polythene spacer is removed, and then you load the light body, replace it back, and then you can see the accuracy. Okay, so they've just taken a model as an example. Okay, so coming to our last two slides, guys. So disinfection of disinfection techniques of materials also important. So type of disinfection is high level, intermediate, and low level. So glutaldehydes are usually the things we are using in the department. Okay, all right. So the impression materials which can be used here, the types are irreversible hydrocolloids, so alginate, zinc oxide, eugenol, polyether, polysulfate. Okay, polysulfate, we are not using addition silicone. Okay, so 10 minutes, just wash it with water, dry it, spray it with the disinfectant, dry it, and usually, ideally, should be placed in a sealed bag. Okay. Intermediate has sodium hypochlorite complex, iodophores, phenols, chlorhexidine, alcohols. Okay, so zinc oxide, eugenol, polyether, addition silicone impression compound. Okay, and this is not recommended. So guys, usually 10 minutes of. Okay, type of disinfection and its mechanism. So ideally, glutaldehyde is non-oxidizing. 2% is used, so it has an alkalizing agent for proteins. Mainly affects the amines, and the sulfaldehyde groups. Okay, so example is Sidex. Okay, for sodium hypochlorite, example is Clorox. Okay, iodophores are also oxidizing. Sorry, sodium hypochlorite also oxidizing 0.5%, 1 to 2%. Okay, so it disturbs the layer of cell membrane here. Proteins are deactivated. Okay, betadine is a common example. Alcohol is non-oxidizing, 60 to 90%. Cell membrane and lipid component is destroyed. Okay, or precipitated, and isopropyl alcohol is used. Chlorhex is non-oxidizing, 2 to 4%. Okay, intracellular contents are coagulated and cell membrane damage. Savlon is a very common example. Sorry, phenolic compounds are used that is non-oxidizing 1 to 3%. It damages the cell membrane. Lysol is a very common example. Okay, so just know the mechanism and know the names of the disinfectant used and what material it uses and the procedure. Okay, guys. So thank you so much for patient listening. Guys, if any questions are there, we are in Polyclinic 3 in the Prosto floor, Prosto lab. Come and ask us questions. Please read and standard textbooks. Again, for FPD, I'm repeating, is Schillenberg and Rosenstiel. Please refer to the standard textbooks and the lecture topics. Thank you for patient listening, guys.